Hiya. Yeah.
You just love to keep women waiting, don't you?
Well, that's my wife. I stood her up on our first date.
Well, do you know, nothing surprises me with you.
Look at her now. She still loves me.
Is it... Am I thinking your wife's the Dr. Amy?
Dr. Amy, yeah.
We met at Leeds University, didn't we, back in 1999, Freshers' Week.
Yep. Random pull in Majestic's nightclub.
And we got married in fourth year at medical school.
We've got 3 children, and we've worked together for about 8 or 9 years.
Do you know, I was shocked, actually. And I said to Neil, I went, I could have imagined him with, like, dolly birds.
She's a dolly bird. She's gorgeous.
Yes, but she's an intellectual dolly bird.
She's gorgeous.
Quite a lot of the patients like the fact that they know us as a couple. I think it helps them to relate to us as individuals.
That definitely helps, yeah. And
we get lots of questions about how are the kids and the dog and...
Yeah. And you can share your own stories and people relate to you as a family and a couple, and I think you can...
Makes you feel more human rather than a doctor.
Absolutely. Right then, down to business.
Yeah, I'm glad I've got to see you, really, because I saw you in January, didn't I? And we left it where I was going for the injection down my leg, which I had.
Did you?
Yes.
Yeah.
And it's been amazing. But things have deteriorated since I saw you. It started a couple of months after I'd seen you because we were doing
Well, I'm just reading through what I'd written, and there's a direct quote. You said, I feel alive again.
And I still do, because I'm not drugged up to eyeballs and I haven't gone back on the medication, no matter how.
So it was right to dig meals in one time.
Shall we give him that one, love?
Yeah,
I'll take that one.
Right then, what's been going on?
What's happening is I've got earache.
Yeah.
And I'm telling my teacher at school it's hurting, so what they've done is put a hot compress on me.
OK.
But it was still hurting.
What's he had for the pain so far?
Calpol.
Does that help a little bit? A little bit. And tell me about this, you've just been sick as well?
I was just thrown up everywhere, I ain't waiting.
Were you sick before this or not?
No.
It's just the first time. OK, so your ear was just hurting at school. It was all right when you went to school this morning, was it?
Yeah.
Yeah. Right, let's check your temperature and then we'll have a good look, see what's going on. It's your left ear that hurts, is it?
Yeah.
OK, well, let's pop this in this ear then.
Yeah, Jayden.
Anyone else been unwell in the family or just you?
Just me.
Just you. OK. Right, let's have a look in your throat and then we'll look in your ears, OK? Just go, ah. Oh, well done. You're very good at that. OK, so your throat's fine. It's not that. I'm going to look in your good ear first, the one that doesn't hurt, and then we'll look in the one that does, all right?
What? No, you can't have no more. Look at it, Jayden's getting his ears done. Look at that! Yeah! Yeah!
Do you mind standing up for me to look in the other one? It'll just be a bit easier. Good lad. Oh, yeah. Oh. OK, have yourself a seat. He has got an ear infection, OK? The right ear looks completely fine, but the left is really red and looks really angry in there, OK?
Right, OK.
So the current guidelines are that you give really good, regular pain relief for the first couple of days.
Right.
Because it's causing him such a lot of pain, I can also give what's called a delayed prescription. So I give you a prescription today for some amoxicillin.
Right.
And if that pain relief that you're going to do isn't settling things down, or if he gets any discharge from that ear, then you start the antibiotics. Does that sound
Right,
okay?
yeah, that's
Is that
perfect.
all right? We try to avoid antibiotics wherever possible because most infections are viruses anyway.
Right.
And then you don't want to take antibiotics for a viral infection because it won't do any help, and it can cause other problems as well as antibiotic resistance in the longer term.
That's absolutely fine. Grab your sick ball, darling.
All right then. OK.
Thank you.
All right then. OK, you're welcome. Get well soon then.
Thank you.
Bye.
Bye. Come on, Jessie Jo. Thank you.
All right, bye.
It's not extreme agony where how it feels, the only way I can describe it is, you know when you've been kicked and you've got the worst bruising ever?
Yeah.
That is how it feels.
Right.
And Even when I just bend slightly, I feel as if my skin's been stretched.
Yeah.
And it's awful.
We do see that. It's called allodynia, and it's where you almost feel pain from things that would not ordinarily give you pain. Bed sheets rubbing over something, like loads of things that's nervous system related. We don't. You change your position.
Yeah.
Do you want to perch on here?
No, I'm all right. I'm going to stand.
There's often not an easy solution to it other than all the other ways that we try to manage your chronic pain. You still, even though you feel that things are worse since I last saw you, you're still a damn sight better than when I
Because
first
I'm
met
not drugged up to eyeballs.
Yeah,
That's
yeah.
why, Doc.
Yeah.
You love that, don't you?
I do, yeah.
Some painkillers for long-term pain can actually be quite unhelpful. In short-term, they're effective, but in long-term use, we find that, firstly, you can develop quite nasty side effects. Secondly, we find that the painkillers become less effective over time. And thirdly, and importantly, the longer you use some of these painkillers, they actually have an effect where they help you to feel pain more rather than take the pain away.
OK, so I think we know
Yeah.
where we're at, and we've started some of the really important stuff, which is to reduce some of those drugs and make you feel human again. Would it be sensible to see me when you're at the point that I might have a go at some of the other drugs? We
Just because you'll miss me, won't you, if I'm gone? Say I'm your shining star.
Well, there is a bit of that as well. Right, so when you're ready, come and see me.
Brilliant.
All right, anything else?
No, that's fine.
All right, good.
Thank you.
Bye.
See ya.